if you are interested to learn about dialectical behavioral therapy, these two books are very good. The one on the left is a dialectical behavioral therapy skills work, is written by 3 doctors and psychologists. Okay, from experience with my patients, they say this is much easier. This one, DBT skills training, this is written by the founder of DBT. Okay, this one is more detailed, but is more, I find the one on the left is much easier if you want to learn about dialectical behavioral therapy. Dialectical behavioral therapy can be done on in different levels. Like we can do it as a skills. Like now I can teach you some skills, you learn it from it. And if you want to do full DBT, like with Alberta Health, it is a group therapy plus work assignment and plus individual therapy. They do this for a few months. This is the best way to do it. But now we are just doing it on like to learn some skills and apply it. Again, this therapy, dialectical behavioral therapy, it was developed by this psychologist. She developed it to help them with overwhelming emotions. She developed it mainly for borderline personality disorder. This is how it started. Borderline personality is a mental health or a mental diagnosis that is has emotional waves. The big problem is emotional dysregulation. But when they start applying it, the therapy for these people, they find studies started to examine, is it good for depression? Is it good for eating disorder? Is it good for addiction? Is it good for bipolar? Is it? And then it has proven that it is good for everything. The word dialectical behavioral therapy, we know therapy, behavioral mean you're going to change some of your behaviors, but the word dialectical, what does it mean? It means dialectic, it means argument. There will be always an argument between two things, two paradoxical things. You know, should I exercise all the time or rest all the time? You know, you need to, you know, balance between both. Should I be dependent on people all the time or be independent all the time? It is balance between both. Should I follow my heart or follow my mind? It is balance between both. Should I change myself or accept myself? It's balance between both. So you see, this is the argument that is going to happen within the therapy. Mainly for emotional waves, big emotional wave. You know, you're going to learn how to serve the emotional wave, whatever it is, anger, guilt, fear, depression and anxiety. You're going to learn some skills, how to serve the wave, not to fight with it, not to try to stop it, because it's not going to stop. Okay. Why some people have overwhelming emotion? This is a big question. Mainly we can summarize it in genetic. Some people are born this way, especially if there is family history, and also environmental. You know, if you grow up in unhealthy family, there is lots of trauma, neglect, abuse. This can also cause overwhelming emotions. Usually the emotions that I'm talking about is last for 20 to 30 minutes. When you feel the emotional tension, half an hour and then it go away. The emotion doesn't continue. The intense emotion doesn't continue more than that because of physiological changes that happen in the brain. So you don't have enough chemicals to maintain certain these emotions ongoing more than 30 minutes. Okay, so tell me more about dialectical behavioral therapy. So dialectical behavioral therapy is mainly 4 things. Distress tolerance, mindfulness, emotion regulation, interpersonal effectiveness. Distress tolerance means you're going to learn some skills to cope with stress. the mindfulness, you're going to learn some skills, how to be present, don't worry about the future, not to regret the past, just to try to be present now and here most of the time. Emotion regulation, you're going to learn some skills, how to regulate this feeling, big emotional waves, how to recognize them, how to observe them, not to overreact, especially in a destructive way. Also, you're going to learn interpersonal effectiveness, which means relationship skills. Mainly you're going to learn how to say no, how to set limits, how to negotiate, how to set boundaries, at the same time maintain the relationship. Oh, you already see lots of patients telling me, oh, now I know how to say no, now I can set boundaries. And then you ask them, and where is the relationship? Oh, it's gone. No, we're going to learn how to do how to maintain the relationship and negotiate and set boundaries. Do the work to implement these skills. Okay, nothing will change by just listening to this session or reading the books that I recommended. You need to apply these things. The same thing with, we finish a series about spirituality, non-attachment, love, gratitude, all this stuff. It's good. It sounds good. It sounds, and these things that I'm going to say today, it sounds good, but you need to apply it into your life, ongoing. So we said dialectical behavioral therapy, 4 things. The first one is the stress tolerance, how to cope with the stress or stress. So it is mainly 2 things you're going to learn. Today, we're going to learn something called the distraction. Next session, we're going to learn something called the self-soothing. Distraction means you distract when you have this big emotions, you distract yourself from these emotions. And instead of overreacting to them and causing you problems, big problems in your life, you will need to learn how to distract yourself. And as I told you, especially the 30-minute of the big wave of emotional wave. You stop you from thinking about the emotional pain. You give some time to relax and respond in a healthy way. Don't confuse distraction with avoidance. Avoidance is a chronic problem. Like distraction is, that you doing this to distract yourself, but you're gonna solve the problem and work on fixing the problem when you have time or you have less emotions or less pain. Avoidance, it become a chronic. We call it a chronic escapism. Like you just escape. If any conflict, you escape just for peace of mind and you know yourself. And no, we want to do this intentionally, not subconsciously. If it become an ongoing thing, it's gonna be very problematic. Self-soothing, this is gonna learn the next session, how to calm yourself, soothe yourself, and regain your strength.